Hey, Dr. Centeno, and let's get into the 3D printed mouthpiece that we use with the PICL procedure. Now, when we first started this, we used an off-the-shelf mouthpiece. It was okay at best, and it needed improvement. We couldn't use metal mouthpieces designed for ENT use because we couldn't x-ray through them. And ultimately, we created what I call the third generation 3D printed mouthpiece. And it worked well enough. Its goal was to control the tongue and allow us to see and preserve a sterile field in the back of the throat where we are injecting for this procedure. Now, ultimately, we did some more research and got to a fourth generation mouthpiece. And in the fourth generation mouthpiece, it was pretty darn good, but it was only pretty darn good for maybe 80% of the patients. The 20% of the patients that were the edge use cases where the patient was too big or too small, or the tongue was too powerful, it wasn't ideal. And then more recently, we've advanced to what I call the fifth generation mouthpiece, where it's really 99% dialed in. And that's because it can manage the airway in all types of patients. And it allows us to take our time in doing the procedure and improve accuracy for those edge use case patients that struggled with the fourth generation mouthpiece. So ultimately, designing a custom mouthpiece is needed for this procedure, and we've got that dialed in.
Hey, get this out to more patients by like, comment, share, subscribe. Thanks so much.